Hi, we're here at ASH, and I'm presenting my poster on determining the differences in quality of life, symptom distress, and fatigue between two groups, patients treated with intensive and then non-intensive treatment or chemotherapy. A lot of older patients have a really dismal prognosis, and the overall end product of collecting this data is really to inform treatment decision making in the future. So we began with describing the differences in quality of life among newly diagnosed older adults with AML, and that's 60 and older. And we followed them for 6 months. And then we also compared 2-year survival up to 2 years. So we cut it off at 2 years, and either they died or the last time that they were at Moffitt to talk to them. And so this was started during COVID in July of 2020, and we completed the last questionnaire in October of 2024. They were all newly diagnosed. We used the functional assessment of cancer therapy, the leukemia version, to measure quality of life, and then we used the Memorial Symptom Assessment short form to measure symptom and symptom distress. And because fatigue is like our most common symptom, we pulled fatigue out and measured that separately with the brief fatigue inventory. So we recruited 200, we consented 206 patients, and then 100 were treated with intensive treatment and 90 with non-intensive. It was predominantly white male. Age was significantly different at baseline between the two groups, with older mean age of 74 years for those treated non-intensively. There was a difference in the level of education also, with the less educated group being the non-intensive ones. And then, so I'm just going to walk you through those differences in quality of life. What is surprising is that at baseline, the brief fatigue inventory, the global distress index, and the FACT-Flu total scores were virtually the same between those treated intensively and non-intensively. But at days 30, you can see that the group, these started to separate. And this is looking at fatigue. So fatigue was statistically significantly different for those treated with intensive therapy, had less fatigue, and those treated intensively at day 60 also had less fatigue, which is counterintuitive. We tend to think that older patients have worse quality of life when we treat them intensively, but that's not what we found. And then that also was true when we looked at their global distress index. There was more distress with symptoms at day 30 and day 60. For the patients who were treated non-intensively, they had worse distress with their symptoms. So with this questionnaire, you go through and you measure each symptom, and then you measure how distressing it is for them. And that's how you come up with the total score. And then looking at day 60 for the physical scores, this is looking at the Memorial Symptom Assessment Scale, physical scale. And then we also pulled out the subscale for physical subscale on the FACT leukemia. And the same trend, those treated intensively had better physical symptoms than the non-intensively treated. We also looked at survival at 2 years between those treated intensively and non-intensively. And you can see that these really separate well. And those patients treated intensively lived longer, 19.3 months, compared to those treated non-intensively, who only lived in 9.3 months. So hopefully we'll have our model developed that is intended to plug in this type of information when you get a baseline, and also look at comorbidities and their frailty and their age and match them on their cytogenetic risk group, so that you could tell a patient when they're coming in for a treatment decision, like, if we treat you intensively, this is how your symptoms and your total quality of life will change over time. And this is the same you'll get these results when we treat you non-intensively, and get them engaged in that discussion about which treatment aligns with what they want. So thank you.